And now I'll turn it over to Dr. Cabrera for his presentation.
Thank you, Governor. Okay, so what I'll be sharing with everyone today is a breakdown of the update on Guam's COVID-19 cases in graph form and introduction of new quarantine, testing, and monitoring requirements for travelers entering Guam. So just to summarize again for everyone, that new case counts tell us the incidence of active disease and active cases on Guam, while test positivity rates tell us how wide of a net we are casting to identify active cases. Our goal ultimately is to keep both as low as possible. So on this graph here, we have COVID-19 new cases and test positivity rates on Guam for the month of June up to present. So on the left side here, you can see the new cases, and now we're using a 7-day rolling average as opposed to previously we're looking at 5-day rolling averages. The reason being that this is more representative of more data that we can see how trends are going overall, and it's also the way that most of the world is looking at their data. So new cases on axis on the left, test positivity rate axis on the right. On the red is the new cases. As you can see, it's gone up, and after June 20th, we've seen a spike up in both new cases and test positivity rate. What we had previously said as a threshold of concern is if we start having more than 5 new cases per day or a test positivity rate above 3%. And as you can see over the past week, we've gone above that threshold. So therefore, we are concerned, and has allowed us to take a deeper look into our data and also into the policies that are set by them. So this slide here takes a look at our testing capacity overall in relation to the new cases per day. And it's a complicated slide, but the summary is basically that if you see this green shaded area, that's good. That means that we're doing a good amount of testing per day overall, but the red side would be that we're not, and that's what it was earlier in the pandemic, and we've done better. And as you can see, we've gotten to a point where it's become much more slim and the area is much less. So it is a warning that the cases, if they continue to go up and if we're not doing enough testing, that that we be going backwards in terms of our progress. When we look at Guam's mobility in relationship to the new cases and the hospitalized, as you can see here in the blue line, that our mobility has been steadily increasing, and our case count here in green this time, you can see it jump up in this part of the graph, which is more recent. But the purple is our hospitalization, and it has not gone up substantially. Right now, we have one patient that's admitted in Guam Memorial Hospital that is COVID positive, but we have not seen a significant spike, which is very reassuring, especially nothing compared to what it was early in the pandemic when we had quite a bit, up to about 25 patients at the peak. So that part is a additional reassurance, despite seeing an increase in number of cases and increased test positivity rate. If we were to zoom in a little bit closer into the days here, you can see, and I'm just pointing out here that June 8 was the day that we set in new quarantine and testing requirements with definition of hotspot areas. But since then, you can see our mobility continues to go up. The number of new cases did go up, almost a couple of weeks after the quarantine changes were made. But again, hospitalization stays low. So that being said, I'm going to move into discussing the new quarantine testing and monitoring requirements for travelers entering Guam. So as you may recall that this is our current process as it is right now, where we had identified international hotspot areas and criteria for quarantine, and then also for non-hotspot areas. This isn't going to be changing. And this is the new policy for travelers entering Guam. So due to the recent increase in COVID-19 cases on Guam and around the world, the following changes will be made to quarantine, testing, and monitoring requirements for all travelers entering Guam, effective after midnight on Wednesday, July 1, 2020. Hotspot locations will be renamed as high-risk areas. For the U.S., risk status will be determined by a state-by-state level on a state-by-state level to include territories. The default level of quarantine required upon entering on Guam is based on whether or not a traveler is coming from a high-risk area. A pre-arrival negative PCR test, in particular those traveling from a high-risk area, is necessary to determine the location of quarantine required and eligibility to qualify for an abbreviated quarantine length. Residency status will not determine the level of quarantine or testing required. Considerations for alternative quarantine locations will still be made in certain limited circumstances. High-risk locations will be determined by a calculated COVID-19 area risk score, which primarily assesses an area's recently calculated case doubling time and test positivity rate. So this flow diagram will allow someone to determine what are going to be their quarantine requirements and testing needs. So if you start out by asking, are you originating from a COVID-19 high-risk area? If you are not, then you automatically go into home self-quarantine. If you are coming from a high-risk area, then the next question is, do you have a negative PCR test within 72 hours prior to arrival on Guam? And if that answer is yes, you do have a negative test, then you can proceed to home/self-quarantine. If you don't have that, then you will be quarantined in a government facility. Now, so in either case, you are going to be quarantined. The question is just whether you'll be at home or will be at a government facility. So once you're in quarantine, those with a negative PCR test within 72 hours prior to arrival on Guam may opt to repeat the PCR test on day 7 of quarantine. Everyone else may opt to test on day 10. Again, this is an optional test to see if you may be eligible for an early release. If you do have that test and it ends up becoming negative, then you have the early quarantine release, but you still must fully comply with the 14-day symptom monitoring and tracking. So that is key. So just because you get out on day 7 doesn't mean you're done completely. You still have to comply with this program for the full 14 days minimum. If you opt to not get a test to try and qualify for early release, then you would have to complete the full 14-day quarantine. And so the last remaining part of this would be to define which are these high-risk areas. And this here is the list now that we have discussed and have decided to list not just countries, as you were familiar from previous hotspot designations, but now we are included U.S. states that are high risk. These include Alabama, Arizona, Arkansas, California, Florida, Georgia, Idaho, Mississippi, Nevada, North Carolina, Oklahoma, Oregon, South Carolina, Tennessee, Texas, and Utah. High-risk Asian/Pacific countries will be Bangladesh, India, Indonesia, Nepal, and the Philippines. Other high-risk continents/areas, Africa, Central America, Middle East, and South America. And this concludes my slide presentation.